and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. New treatment guidelines that have been released for a personalized approach for treating patients with irritable bowel syndrome. New treatment guidelines that were recently released in the gastroenterology outline a more personalized approach for treating patients with approved drug treatments for irritable bowel syndrome with either constipation or irritable bowel syndrome with diarrhea. Now, we all know that irritable bowel syndrome is one of the most common disorders of both the intestines, affecting up to around 35 million people globally. The guidelines outline for the first time when to use the newly introduced irritable bowel syndrome drugs, when to rely on the old drugs that were previously approved by the FDA, and when to use over-the-counter drugs. Now, with more treatments available, the physicians can tailor a more personalized approach based on the symptoms a patient is usually experiencing. The researchers advised to prioritize lifestyle modifications that included exercising regularly, sleep, stress reductions, and even dietary modifications or changes such as increasing more of fiber diet in their intake. Prior all this to seeking an irritable bowel syndrome specialist, such as usually a gastroenterologist, for advanced treatment options. Now, when you do speak to a provider, be clear on your symptoms to help your doctor determine the medication that is very apt for you. Therefore, the researchers concluded that having so many treatment options, the practitioners can now take a targeted treatment approach to the patient's symptoms. It's very important for patients to be open about their irritable bowel syndrome symptoms, and just as important for gastroenterologists to set realistic expectations for this chronic disease to ensure the best quality of life for such patients. Several harmful effects caused by e-cigarettes. E-cigarettes have become increasingly popular among adolescents, and the latest available scientific evidence suggests that the use of these products have adverse health effects that may occur over a period of time, leading to an increased risk of developing cardiovascular disease or even pulmonary disease over the course of the life of people who generally use e-cigarettes on a regular basis. This is in accordance to a new scientific statement that was released by the American Heart Association's journal, which is Circulation. In the researchers' statement, they reviewed evidence-based studies that focused primarily on the cardiopulmonary effects of e-cigarettes use in adolescents to inform on how the short and the long-term risks of vaping, and also provided guidance to reduce vaping among the adolescent group. Other than nicotine, e-liquids, they contain vegetable glycerine, propylene glycol, which are on the FDA's safe list. The statement suggests certain measures for reducing or rather preventing the youth vaping. Firstly, it mentioned to remove all the flavored e-cigarettes, including menthol flavored e-cigarettes, from the market. Secondly, to provide more education for the youth and their parents regarding the confirmed and the potential health risks of such use. Then establish vaping curriculum for medical students to inform the next generation of healthcare professionals. Also, to ensure hospital-based vaping cessation programs for adolescents and adults. Regulate the marketing of e-cigarette products in traditional, outline and social media platforms that are popular among the youth. And lastly, incorporate e-cigarettes into smoke-free air laws. According to the statement that was released, the toxicity of e-cigarettes remains very poorly understood. It is apart because most of the e-cigarette manufacturers have not publicly disclosed the full list of ingredients of many e-cigarette products. Now, since the exact composition of the products within the devices is not well understood or not known as yet, it is still difficult to predict or determine the health effects on the lungs and the heart. So please be careful. The longer side effects of COVID-19 in women than compared to men. Long COVID is a syndrome in which the complications persist more than 4 weeks period after the initial infection of COVID-19, and sometimes for even many months. A new study published in the Current Medical Research and Opinion Journal, it reveals that females are significantly more likely to suffer from long COVID than their male counterparts and will experience substantially different symptoms than their males. The analysis of the data was from around 1.3 million patients, and observed females with long COVID. They were presenting with a variety of symptoms including ear, nose and throat issues, mood disorders, neurological, skin, gastrointestinal and even rheumatological disorders, as well as fatigue. While the male patients, however, were more likely to experience endocrine disorders such as diabetes or even kidney disorders. Now, the differences in the immune system function between females and males could be an important driver of sex differences in long COVID syndrome. Now, females mount more rapid and robust innate and adaptive immune responses. We all know that, right? Which can protect them from initial infection and severity. However, this same difference can render females to be more vulnerable to prolonged autoimmune related diseases. Previously, plenty of studies have examined sex differences in hospitalizations, ICU admissions, ventilation support, and even mortality. But the research on the specific conditions that are caused by the virus and the long-term damage to the body have been understood very little when it comes to the gender. However, the current study did highlight the fact that long COVID does affect women far more than the male population. The rising concern on post-operative mortality following tonsillectomy in children. The increasing rates of post-operative death in children undergoing tonsillectomy is quite uncertain. The mortality rates are not separately reported for children per se at an increased risk of complications, including young children and those with sleep-disordered breathing or even complex chronic conditions. A recent retrospective cohort study that was published in the JAMA network, it included close to 5 lakh participants who were younger than 21 years of age, for whom discharge records were easily available to link either outpatient or inpatient tonsillectomy that was carried out with at least 90 days of follow-up period. The post-operative death was characterized as death within 30 days or during a surgical stay which is longer than the 30-day window period. Now, out of the total 5 lakh children, 10.1% tonsillectomies were performed in young children, 28.9% in those with sleep-disordered breathing, and 2.8% in those with complex chronic conditions. It was therefore found that there were 36 post-operative deaths which occurred in 4.5 days after the surgical admission, and most of which occurred after surgical discharge. Additionally, neither those younger than 3 years nor the sleep-disordered breathing group was significantly associated with mortality, but children with complex chronic conditions had a higher mortality rate. Children with complex chronic conditions, they accounted for 2.8% of the tonsillectomies but 44% of post-operative death. Most deaths associated with complex chronic conditions occurred in children with neurological or neuromuscular or congenital disorders. Therefore, the researchers concluded that among children who are undergoing tonsillectomy, the rate of post-operative death was 7 per 1 lakh operations overall and 117 per 1 lakh operations among children with complex chronic conditions. Hence, these findings definitely will help practitioners in decision making before performing pediatric tonsillectomy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.